Have you ever wondered what behavioral addiction is? It's an intriguing question, isn't it? Behavioral addiction, also known as process addiction, is a fascinating and complex area of psychology. It's similar to substance addiction in the way it can affect a person's life, creating problems in various areas from relationships to work to overall mental health. Interestingly, only one behavioral addiction is officially recognized in the field, and that's gambling disorder. However, it's crucial to understand that other compulsive behaviors, even if they're not officially acknowledged as addictions, can lead to significant issues. These can range from compulsive shopping to excessive video gaming, and they can be just as hard to quit as substance addictions. The underlying mechanisms of behavioral addiction, much like substance addiction, can be traced back to the brain's reward system. This system is triggered, releasing a surge of dopamine, creating feelings of pleasure and satisfaction. Over time, this repeated behavior can lead to dependence and addiction. Behavioral addiction, although not as well known as substance addiction, can have equally devastating effects on a person's life. It's a silent battle, often fought behind closed doors, but with understanding and awareness, we can start to break down the stigma surrounding it. Now that we know what behavioral addiction is, what are some telltale signs of this condition? Behavioral addiction can be quite elusive, often manifesting subtly in one's life. One of the primary red flags to look out for is the continual seeking out of opportunities to engage in the addictive behavior, irrespective of the circumstances. For instance, someone with an addiction to gambling might find themselves constantly looking for chances to place bets, even when it's causing financial strain. Another key indicator is the persistence of the behavior despite negative consequences. This could mean continuing to indulge in the addictive behavior, even when it's causing problems in relationships, work, or other areas of life. It's not uncommon for someone with a behavioral addiction to prioritize their addictive behavior over their responsibilities or relationships, leading to significant disruptions in their daily life. It's important to remember that acknowledging these signs isn't about assigning blame or generating guilt, but about recognizing the problem. This recognition is the first vital step towards addressing the issue and seeking help. Spotting these signs early can make a significant difference in managing behavioral addiction. Behavioral addiction can take a toll on one's life. But what exactly are these effects, and how can it be treated? This type of addiction can impact various areas of a person's life, often leading to significant issues. It can strain relationships, affect job performance, and even compromise physical health. The psychological effects are also profound, with feelings of guilt, shame, and low self-esteem often accompanying these addictive behaviors. Treatment for behavioral addiction often mirrors those used for substance dependencies. Cognitive behavioral therapy, for instance, can help individuals understand their addiction and develop coping strategies. Motivational interviewing can also be beneficial, focusing on increasing a person's motivation to change their behavior. In addition to therapy, seeing a psychiatrist or psychologist can provide further support. These professionals can offer a safe space to discuss feelings and fears, and can often prescribe medication if necessary. It's important to remember that seeking help is a sign of strength, not weakness. If you're struggling with a behavioral addiction, don't hesitate to reach out. There are numerous resources available, from self-help books to support groups. Remember, it can be challenging to admit to having a problem with a behavioral addiction, but help and support are always available.